Hi, my name is Sarah Brown. I am doing my presentation on the gastrointestinal and the endocrine system. I'm going to start with the gastrointestinal system, and one disease I chose was IBS, which is irritable bowel syndrome. I chose this because a family member of mine has it, and I'm interested in looking more into it. IBS is chronic abdominal bloating, cramping, and pain, as well as altered bowel habits. Irritable bowel syndrome is the most common gastrointestinal diagnosis in the U.S. IBS etiology appears to entail interaction of both genes and the environment. I found very interesting as I was reading my article that the most patent contributor to IBS is sexual abuse. Physical and emotional abuse contribute to IBS, but sexual abuse is the most patent. Women are more frequently diagnosed with IBS rather than men. Moving on to the endocrine system, I chose papillary thyroid cancer, and I was interested in looking into this because my mother is diagnosed with it. Papillary thyroid cancer accounts approximately for 85% of thyroid cancer. This cancer is the decreased mutation densities of cancers that have been studied by means of whole exome sequencing. Treatment for papillary thyroid cancer includes a lobectomy and a total thyroidectomy, and then you can go non-surgically, which you do the iodine treatment. Papillary thyroid carcinomas that are less than 1 centimeter in dimension occur up to 30% of adults in the general population. And which I found very interesting is that papillary microcarcinomas do not progress, which I found interesting because most cancers progress. Next, under the endocrine system, I did gestational diabetes. I was interested, in looking more into this because I would like to be an OB nurse. And I feel as being an OB nurse and working with the mothers having babies and that I need to be more aware on what it is and educated on it. Gestational diabetes is any degree of glucose intolerance with the onset of first recognition during pregnancy. Gestational diabetes is 7% of all pregnancies are complicated with it, and more than 200,000 cases are found annually. Women with gestational diabetes are at increased risk of type 2 diabetes after pregnancy. And which I found interesting is women with gestational diabetes are at increased risk of obesity and glucose intolerance. And gestational diabetes increases your risk of fetal microcarcinomas. I hope you enjoyed my presentation. Thank you for taking the time to watch this.